What's up, everybody? Welcome back to Ethan's Exotic Escapades. Today we are back at Aquatic Planet with Todd, and we are going to be talking about some parasites and how we can deal with parasites. We're actually going to be mixing up something that can help fish with parasites and diseases. And if you like this video, make sure you like and subscribe to join the tribe. And let's get started.
Hey guys, this is Todd from Aquatic Planet. Today I'm going to show you how I mix up an oral type of medication that is an antibiotic and a parasite cleanse for the fish. One of the main things is the fish have to still be eating because they need to ingest this medication. This is something that a lot of people don't do, but I've been doing it for about 3 years and I've got it to where it works out pretty well. So I don't have exact measurements, so you're gonna have to kind of watch and see how much I put in here for. I do this for anchor worms, for internal parasites like tapeworms. I do it for if they have some sort of a fungal disease or some sort of a bacterial or some spots that I don't know what it is. A lot of times I'll give them oral antibiotics. The antibiotics come in this form, and it's in a powder sachet like this. And then XLP is for like really stubborn belly worms, and then this one is for all kinds of different external parasites. So today I'm going to do Paracleanse with this, and then I also use unflavored gelatin because unflavored gelatin binds and holds the medicine into the fish food, so it's very important. It also is kind of stinky and the fish like the taste. Another item that I use is garlic guard. I'm only going to put 6 to 8 ounces or 6 to 8 drops in here because it goes a long way, and if you overdose this they won't like the taste of the garlic guard, but it does help mask the flavor of the medicines. So the first thing I do is I fill this up and I warmed it up in the microwave just so it will dissolve the gelatin really quickly and it'll kind of go over everything. Then I'm going to put some of the fish food in here, and I want it to be able to cover it totally. It's going to swell up, so that's about the right amount. You can see there, because it's going to absorb a lot of that. So now it's important to start putting the medicines in there. So the first one I'm going to put in is the antibiotic sachet. And with about this much food and water in there, I put the whole packet in there. And this works. This is better than just putting these medications willy-nilly in your water, because you know it's going to get into their digestive system and it's going to get into their body. They're not just absorbing it through the gills. The next one is Paracleanse. That's this one here. I'm going to put that in there, and I use possibly the entire packet. So I'm going to kind of space it around. This kind of has a bitter taste that they still will eat it, especially if I feed them this in the morning when they're really hungry. They'll kind of not balk at it. The next thing I want to put in, and I'm probably going to have to open up another packet, is the unflavored gelatin. The unflavored gelatin is stinky and it's going to gelatinize in there. Yeah, I definitely need another one. It's going to gelatinize and it's going to hold all of that medicine inside the food, and it's going to help it absorb because we're about to stir all of that up. So I'm going to I always overdose, not quite a full, but that's about as much as I put in there. But I overdose a little bit and it'll just be a little chewy for them. And then it's important at this point for me to start mixing it up. So I'm just going to use some tongs. See, the gelatin is already trying to bind it. So I'm just going to stir up this soup. It kind of looks like dog food, and you add some water into the dog food, stir it up like gravy train. But stirring it up real good. I don't mind if it busts it up a little bit because it's all going to be turned into, like, the gelatin's going to make it like Jello. Okay, so now I've got them all in there. The next thing I want to put in there is garlic guard. I'm going to put probably 8 drops in here. So I just want to be careful. Ooh, that's like 3, 4, 5, 6, 7, 8. Okay. Don't want to put too much in there. But again, garlic guard will mask the bitterness from the medicine, because I have antibiotics in here and I have Paracleanse, which is the anti-parasite medication. So I'm gonna pat all those down. I want them to be kind of underwater, so to speak. And then we're gonna throw these in the freezer. The freezer will allow it to gelatinize. And then I'm gonna come back and we're gonna talk about something else. So I'm gonna put this in the freezer for a while. And now we're gonna go over here. And I'm gonna talk about the medications that I use more than any of the others in the store. So if you have ick is so common. So many people think they know what they're doing and they don't know what they're doing. There's all kinds of techniques that will work, but the techniques I gained from a guy named Mike who's at Carolina Aquatics. He has a master's degree from Florida. This guy knows fish. He did his studies for his graduate program down in Colombia, so he has got great connections. He also spent about 8 months in Thailand. This dude knows his stuff, and I got this from him. So he knows better than me, and I've been doing it now for 3 years, and it works really well. What you need is something like copper. Copper is the most effective. I prefer Copper Safe over the others, although the others work really well. Another one that I like is cupramine. Cupramine is copper from a different company. This is from Seachem. Sometimes if I find, and there are resistant forms of ick is a little tiny worm, and it forms dots and specks. It looks like pepper all over your fish. If you get that, copper is the best thing, but you don't want to overdose it. You got to be careful with it. So because of that, I sell copper testing kits. So when you want to, in 2 days, when you want to apply your second dose, you want to make sure that the copper isn't too high. The copper needs to be at a 1.5 to a 2.0 to be killing the parasites. So if you get it too low, then it's not going to work. But I use cupramine sometimes if this hasn't been as effective, and sometimes switching between these two every other day seems to work really, really well. I just did it this week and it worked again. So I like both of these a lot, but I always use ICX together with copper. I don't put them both in at the same time because that's too much kind of harmful chemicals in at the same time, so I wait at least a half hour before I introduce the ICX, but we'll put copper in first. Copper is going to kill anything in there. If you have crustaceans like shrimp or crawfish, they will die from the copper. Also, snails will be killed from the copper, so you want to make sure you don't have that in there. Also, anytime you're putting medication, you need to remove the carbon filter from your tank. I don't even use carbon filters, FYI, in my tanks. So Copper Safe and ICX are two that I use the most. And I also like the cupramine. I also will use Copper Power Green. I just used it today. It works as well. It's a little bit more economical. But I like, those are the 3 forms of copper that I sell at the store. Another one that I use a lot is Paragard. If I think they've been biting each other and their fins are a little tore up, I might throw some Paragard in there. Paragard is good for bacterial problems, minor parasitic issues, but also fungal issues. Also, ICX deals with fungus and some bacteria issues as well. So this is my go-to. I use this at the store quite a bit when I get a new batch of fish. Let's say I bought 12 fish and 2 or 3 are floating around looking sick, then I'll put this in with their tank just to kind of give them a boost. Another one that's really good that's an antiseptic is Stress Guard. Stress Guard's another good one. It's gonna kill minor bacterial issues and kind of help your fish out if they're new to your tank, or if you see a fish that's just kind of not acting himself, you might want to throw some Stress Guard in. But there's so many issues that we can talk about. I give a class every third Saturday at 10:30 in the morning. They only last a half hour. They're completely free, and I do one of them that's totally on fish disease. So I try to cram everything into about a 30-minute process. So Anyways, thanks for joining us, and we'll show you the gelatinized stuff, and then I'll feed it to the fish later, and you guys will be able to see the fish actually eating the stuff. But and maybe I'll talk a little bit more about why it's important to feed the medication versus just dropping it in the water. Another thing that's very important is if you have a hospital tank, is if your fish is sick and you can see physical disease, parasites sitting on them, remove them from the tank and treat them in a smaller tank, because that's going to be more economical. If I tried to treat my fish in a big tank like this is 90 gallons, it's going to be more expensive than if I can move that fish to a 20 gallon, because then I don't have to put as much chemical in it. But also what you're doing is you're trying to help the other fish. If one fish is sick and maybe it hasn't spread yet to the other fish, then you want to remove that fish. I would treat the big tank at least once and then monitor it, and then I would treat the fish separately in a small hospital tank. That's what I do. Okay, we're going to take out the food that we made today. It was several hours ago, so it's probably frozen now, but it'll thaw out. But now the gelatin has seized everything, and we can feed this to the fish. So it's a little frozen right now, so we're going to let it thaw out, and then I'll feed it later on. But this is so much more important, because when you can put the antibiotics through their mouth into their stomach, it has a better chance than them absorbing the antibiotics and the parasite stuff through the water, through their gills and through their skin scales. So anyways, this is a really important thing. Not a lot of people do this. Not a lot of people know about how to do this. I've been doing it on my own for about 3 years though. And so I've tried, I've adjusted things. I think I've got it pretty good now. So the next thing we're going to talk about is different diseases, but just the common ones. The most common is ick. Ick it's a little white worm. The white worm swims freely, it attaches to its host, and it stays on the host for a while, and then it drops to the bottom, and it lives in the rocks for a few days. It releases its eggs, has a bunch of babies, and then it continues the cycle. So one of the ways to kill them is when they're free swimming. And so that's what people who raise the temperature of the water to 86, they add aquarium salt in there. Those things can definitely help, but they're not like what I do. I do copper, and this comes from somebody with a master's degree in fish biology. He uses copper and he uses ICX, and it works. They hate copper, but copper, again, you have to test it to make sure you don't overdose it, because it can kill the fish. It will definitely kill any invertebrates that you have, like snails or shrimp, so you can't use it for that. But it's a really, really effective way. So if you have ick looks like somebody took some salt and sprinkled salt all over your fish. It looks like little white kind of spots. And it usually will get over the fins. Sometimes it'll go on their eyeballs. It'll go everywhere. But if you use copper, usually you can save most of your fish. You don't have to increase the temperature. You don't have to put an ick treatment in there that says it's for ick. I use ICX. ICX dehydrates the babies when the babies are free swimming. ICX dehydrates them. It makes them have diarrhea, and they just die because they can't eat, and so they die in a day or two because of ICX. Copper kills them on the body of the fish. It kills it down in the gravel, wherever they are. Copper kills. Copper works really well. I use Copper Safe, Cupramine, and Super Copper Power. And the other thing that comes up is velvet. I've had a few cases of velvet over the years. I use the same thing. I use copper, and I use ICX to treat that. Copper is a tiny little parasite that's round, and it kind of wheels around under a microscope. It looks like a saw blade almost. And when you get that, it looks like kind of golden velvet all over their whole body. Once it gets really strong, it will cover their whole body, and that's a problem. This will kill the fish. It gets in the gills, it eats the fins, and it'll kill them. And it's more stubborn, but copper is the best thing to get rid of that for them. Copper with Icex. I usually use them in tandem. Another one is Costia. Costia normally affects live bears like your guppies, your platies, swordtails, mollies, and also corridoras. It tends to affect them. This is one where my 40 magnification microscope won't work, so you have to have a microscope that goes 250 times so that you can see them. They're so tiny, they look like fleas. And they just get under the scales and they just kind of eat the tissue and irritate the fish. You'll see the fish swimming on the bottom and kind of rubbing on the bottom of the tank, rubbing against rocks, stuff like that to get them off. They do the same thing with ick. They do the same thing with velvet. But that's a bad disease. With that one, I treat with Paragard. You can also use copper. Copper will also wipe that out. But Paragard works really well on Costia for some reason. So those are the basic ones that I deal with. The gill flukes, I use copper once again. Again, that's a worm that attaches like an anchor worm or a gill fluke. It's like a worm that attaches to the gills. Anchor worms will attach to the side of the body, all over the body. They'll get in the gills as well. That I treat with copper. Any parasite, I treat with copper, and it works really, really well. I've been doing this 6 days a week inside this store, sometimes 7 days a week for many years, and I know what works, I know what doesn't work. I don't want to fool with increasing the temperature and adding aquarium salt. The copper works. It does hurt your biofilter a little bit, but it doesn't totally break down or kill your biofilter. At least in my experience, it hasn't. Ethan and I are about to go to Carolina Aquatics for their open house up in Kernersville, North Carolina, which is north of Charlotte a bit. And Ethan is going to get to meet Mike. Mike is the guy from University of Florida. Go Dogs. I don't like Florida. And I don't care for Clemson all that much either, by the way. But anyways, we're going to do that, and I'm so glad that Ethan gets to meet Mike, because Mike is great. He's a soft-spoken, chilled-out guy, but boy, does he have knowledge, and he bases most everything he does scientifically through a microscope, and he's the one who's taught me. He's cleared up so much junk that's on the internet about how to treat fish for fish disease. Okay, now we've got the medication. The gelatin has fixed it, and we put it in the freezer for a while. Didn't need to really do it that long, but what I will always do is I'll mash it up into some bits and see these guys are all ready because they know I'm about to feed them something. So we put the garlic garden in there, so hopefully they might spit it out a little bit, but they're hungry and they're kind of food motivated, so they're gonna go for it. So here we go. I'm gonna dump it in there. That way everybody gets some of this stuff. And I'm just doing this as a precaution. I've already treated stuff, and I'm just, we had a little bit of some anchor worms in here. And so this will help them with that. Normally I do this in the morning, first thing when they're starving, and they eat it so well. And like the other benefit is, you know, I got little particles floating around. That still has the medication, so they are going to be able to absorb the stuff, so it's not like it's going to be a total waste. But they'll go through and pick out a lot of that. So, anyways, that's that. It's that easy. You feed it, and normally I'll go through, for this many big fish, I'd probably use about 2/3 of this for one day, for one treatment, because I want to give them a strong dose of the antibiotics and a strong dose of the Paracleanse to get rid of whatever is ailing them. But anyways, thanks for joining us.
All right, that's going to do it for today's video. If you like this video, make sure you like and subscribe to join the tribe, and I'll see you on the next one.